There's a war in Africa, specifically in Sierra Leone. It's not a war of guns or bombs, but it's one with an epidemic of substance abuse. A drug called Kush, which is different from the one found in the US, has destroyed the lives of the nation's youth, prompting President Julius Maada Bio to call a state of emergency in order to tackle this. But what is Kush, and why has it become such a major threat to the young population of Sierra Leone? To answer these questions, we will talk about four things. What really is Kush and its impact? What role does unemployment and desperation play? What is the gender and age gap? And then what is the government doing about this? So without wasting your time, let's get into this. Kush is a dangerous mixture of marijuana, fentanyl, formaldehyde, tramadol, and even human bones. Yes, you heard that correctly, human bones, making it very potent and addictive to drug users. Users of Kush often descend into a zombie-like state, experiencing cognitive impairment, swollen limbs, falling asleep while walking, banging their heads against hard surfaces, and even walking into moving traffic. It is often called the death trap, as it pushes people into a cycle of despair to the point of scavenging for dead bodies in graveyards. What is even more alarming is the staggering death toll, with rates going as high as 4,000%, with hundreds of young people succumbing to organ failure, mental health issues, and illnesses. Sierra Leone has yet to release an official death toll associated with this Kush, but medical experts warn that its impact might be devastating. Despite being introduced only 4 years ago, Kush quickly gained popularity among Sierra Leone's youth, exacerbating an already existing unemployment crisis. With nearly 50% of young people unemployed and having nothing to do, many have turned to drugs like the Kush as a means of escaping this harsh reality that they found themselves, with some even saying that it helps them to forget, hence the desperation to rob graveyards. It is important to recognize that addiction knows no bound, as it can affect anyone of any age or gender. Data suggests that the majority of Kush users fall within the age bracket of 16 to 30 years old, with an average hovering around 20 to 22 years old. Among this demographic, men far outnumber the number of women, which can be attributed to many factors, including societal expectations, peer pressure, and even economic factors, contributing to the higher abuse of this substance amongst young men in Sierra Leone. In response to this Kush epidemic, President Bio has taken some bold steps in order to stop this spread. A new anti-drug police task force has been established to break the supply chain and to apprehend drug peddlers. The police force has reported finding young men digging up graves late at night when people are far asleep. Graveyards have now become the hot spot for scavenging of human bones. It means even the dead are no longer safe. And so by intensifying surveillance and enforcement efforts, the authorities hope that these measures will help to curb these activities. Also, temporary hospitals have been established in order to cater to the need of drug overdose cases. Medical workers are now at the front line, providing critical care and support to those crippled by this Kush. President Bio's decisive actions have shown that he does care about the people of Sierra Leone. By prioritizing the health and the well-being of its citizens, the government are laying the groundwork for a better and safer and healthier environment for generations to come. The stigma surrounding addiction is much more pronounced in religious communities, with some individuals being condemned, shamed, and even physically abused due to their addiction. And so, to combat this stigma and foster empathy, interfaith conferences have been established, urging religious leaders to come together to recognize and acknowledge that addiction is indeed an illness. And so the aim is to debunk myth and encourage communities to offer compassion rather than condemn people struggling with this addiction. The civilian psychiatric hospital also plays a vital role in treating individuals struggling with mental health issues linking to substance abuse. However, they also struggle with limited resources and space, leaving many Kush victims without help. It's important to recognize that the addiction to this Kush can develop quickly, with many users getting addicted just after one use, which is actually common for most substances being abused out there. And so timely intervention is very important in order to combat this substance abuse. This is a life and death situation, and the fate of Sierra Leone's youth is hanging on a balance. What steps are we taking to ensure a drug-free future for generations to come? Can President Bio's efforts to combat Kush addiction succeed? Only time will tell. Share your thoughts in the comments. See you next time.